Hey everybody, we're just going to start rolling people into here. This was by far our biggest webinar, so clearly y'all are thinking about outcomes and outputs. So yeah, there's over 200 people signed up, which is crazy because that's that's like insane. That's way more than our usual. Even our biggest webinar where we have like deputy ministers and things like that and chiefs of police didn't crack that. So clearly this is striking a nerve out there. So excited to share with you guys what our insights are and our learnings have been on this. In the meantime, just because there is lots of people coming in, we want to test um, the chat function. So say hello, name, organization, and First Nations, Métis, or Inuit territory, or even if you know the original name of the place, that's really cool to learn about too, just because this is a pretty big country and really nice to meet everybody that ends up in this little community here. So we've got Jody. I'll do some shout outs while people join just for the first minute or two to make sure everybody's here. So Casa, oh, nice to meet you from Edmonton, Alberta. Jen from Northumberland County, Ontario, awesome. And Halifax, Nova Scotia, Serenity Renewal for Families, awesome to see you. Doris from Street Mission in Oakville, Ontario. Yeah, I should say we've got tons of people from Ontario, tons of people from BC and Alberta, actually everywhere except in Northern Territory. So we're going to have to do a better job reaching out to our colleagues in the north as well. But literally every province except for PEI. So we'll put that on our to-do list as well. Ryan from Aboriginal Legal Services, Toronto, Eloise from Manitoba Possible in Winnipeg, Amber from City of Edmonton. Hi, Amber, just up the road from myself, and Alina here from Calgary in the Treaty 7 territories, and Mohkinstsis is Calgary's name for this place. United Way of Calgary and area. Hi, OB. Lee from Treaty 6, Edmonton Native Counseling Services of Alberta. Let's see, Climate Action Partnership, and that's Hamilton. The Traditional Territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. This is as much about me learning learning how to pronounce place names as well. And Nora, hi Nora, Namarin Housing. We've had a partnership with these guys for a long time, and awesome. You know what? 10:03. We're gonna get going because hey, we've got lots to say, and we want to hear from you all too. So I'm gonna share my screen, and we will get the party started. So I'll start off by, again, by virtue of acknowledging where everybody else is joining us from, our land acknowledgement too. And I mentioned that we are in Treaty 7, where we're joining you from. We're a Canadian company, or B Corp, if you're familiar with social enterprise language. And we focus on technology for the social sector, but all of us are in different parts of the country. So I myself am in Calgary, but Taj, who's also on the call, is Treaty 6 in Edmonton, Alberta, and we've got folks in Toronto, BC, the coast, etc. So welcome everyone, and if you're not sure why you're here, hopefully the title is going to remind you. So rethinking how nonprofits measure and report impact, and it's really about challenging the whole output counting to outcomes-driven practice. And then how do we do that without adding more pain to our staff team? So you're all coming from different walks of life in terms of background and experience in this world, and how does data measurement happen in your day-to-day work. Some of you are coming from a funder perspective today. So we saw some United Ways, we saw some municipalities, regional governments. There's some federal and provincial governments on the line as well. So you're going to have one lens as a funder. And so we'll make sure we touch on that. And then we've got those of you that are delivering the service, delivering the value. to the folks that you're supporting. So you're probably thinking about, how do I write these funder reports? How do I show my value to board of directors meetings? How do I assess whether my team is making the impact for the community I'm serving? So we'll touch on all of the above. And this is the next hour. We'll make sure, like I said, we create some space for questions as well. So by all means, it's not going to just be me talking. In fact, I only have about half an hour of talk theory, some of the new practices coming out and best practices, framings around what we know in terms of outputs, outcomes, and the cost of this gap. Some new frameworks that are emerging as well, just so you're aware and they're coming through from a national perspective in the philanthropy sector, making some interesting headway from a data measurement approaches as related to outputs and outcomes. So I want to make sure you're aware of that. What good looks like in practice. So how do you operationalize this in day-to-day work without adding more burden? We'll show you a real example from one of our use cases in Ottawa, actually, and just to give you something more tangible to see how you might actually put this in practice in day to day. We'll do the Q&A and then get into it. So how to engage, questions in the chat at any time. Taj is here, so he might actually interject. And sometimes he does really gently nudges me to respond to a question, and that's super great. So don't hesitate to ask. He knows the deck though, so if your question is going to get addressed later on, he might just let me keep going and not worry about it. But if it fits naturally, by all means, we'll address it as we go. We will absolutely send you the slides and recording in the next 24 hours. And as you go through this, if there's resources that you're like, man, I wish I could have an X, we do have ability to share some of those. So let us know what those might be. Last time when we did a session on not Indigenous data sovereignty, that's actually next webinar, Canadian data sovereignty. Folks were asking, like, do you have a list of where data hosting can happen that is Canadian? So, and that just came up in the session, and we were able to turn that around really quickly. So resources that get it, you think of on the spot, don't hesitate to ask for them, because we can help. So we'll get into the problem and just to put some framing on it. I don't think I've met an organization in the social sector, and I've been around the social sector since I was a client in the social sector. So when I was a teen, a preteen, actually, and the data that was collected about me as a client, and then that I was in turn collecting as a frontline worker about my clients, and then later on expecting my funded organizations to collect for me as their funder, was insane. So I'm not here to tell you that you need to collect more data, right? It's actually about whether the data that you are collecting is showing what's actually changing, or is it just something that you have to do for that next funder report? And so I'm not taking away from the funder reports. Like I said, I'm a recovering funder. I know how critical this is. But I'm saying, is there a way that we can actually, through the journey of the person that we're supposed to be helping, naturally or organically collect the outputs and the outcomes data we need to answer these questions without burdening ourselves and the client? And, to be fair to the funders, we had to make sense of a whole lot of mess as well. So it's for all of our benefits to make this work better. So the pressure you're probably all feeling as funders, what's changing as a result of your investments? So increasingly, we're trying to tie renewals to outcome evidence because of that pressure, and not just activity counts. You're probably thinking about portfolio comparability as a funder, and is this investment doing a better job than that investment? But at the end of the day, what's changing, right, as a result of years of investment in a particular cause or target group? Boards of nonprofits, the pressure on the nonprofit might be, asking for evidence on how programs perform and pushing leadership for that sharper performance signal. So asking sharper questions around operational efficiency. Are we getting value for that program? How is that program comparing to that program within the organization as well? So funders tend to focus on funding programs that are part of their portfolio, but boards are looking at a holistically at the organization and probably comparing um, unlike programs to each other as well, because again, I've never met an organization that only does one thing. There's usually a range of programs that, you've got youth programs sitting us alongside food security programs, sitting alongside a shelter program and a drop-in youth center. And so you're trying to explain to your board, like, these are completely different interventions, but the boards are trying to compare them to each other and asking, can we be more efficient potentially? Again, I'm not in the boardroom. I'm just telling you what I'm seeing in the exposure I do have. And then more broadly, the communities that you're operating in, whether you're a funder or you're a nonprofit provider, are asking, are lives improving? So they want to see that measurement reflects their lived experience and not external definitions imposed on them. So your folks that are supporting their referral networks, their informal networks of support are asking these as well. Very different framings, but same underlying issue, showing us outcomes, not outputs. So the most awkward thing is when people ask, well, what change have you made? And you're like, well, I gave out this many packages of food. And it's like, okay, like, I get it, of course, right? But what's the outcome longer term? So output and outcome, I know everybody's seen this before. This is just to ground us and remind us. So output is about what did we do, activities, units, throughput, easy to count, easy to report. So the example would be those shelter beds that you provided, the mental health intakes completed, employment workshops, attendees that came to your workshop, settlement plans that you might have drafted, safety plans you might have drafted. You can probably fill this bucket on the left-hand side with so many more examples. Food hampers delivered, rides completed, etc. Outcomes change because of that, though is a little bit tougher. So this is about changes in lives, changes in capacity, changes in conditions, much harder, like I said, to count and harder to fake, right? And the line of sight between output and outcome, right? It has to be clear, right? So why are you doing the shelter bed provision if you can't show that clients move to stable housing within 90 days after leaving, if that's part of the work? Now, not everybody is looking at outcomes, and I'm really wanting to acknowledge this. We often get into a implementation, and our clients ask us to implement the data system to collect lots of outputs, and we're always trying to kind of pepper in, like, what about outcomes? What about this? What about this? And they to be honest, sometimes we have to remind them about that. And so I also want to be honest that not everybody's in the outcome world yet, but the fact that you're here, you're probably interested in that. And I would say it's really good thing to do upfront if you're creating a data system, and I'll show you why. Because if you don't think about it upfront, it's really tough, right? Your logic models don't work, your theory of change doesn't pan out, and you're definitely not going to be collecting the right data upfront. So examples of outcomes, just to compare and contrast between these. Oops, sorry, you guys can still see this, right? 64% of shelter clients that move to stable housing within 90 days. You can probably get an idea that that's actually, something that you actually need to think about. Average scores improved at a cohort level. So if you're running it, this is just a one example of an assessment tool, but let's just make this a little bit bigger. But if you're thinking, there's a lot of mental health clinical assessments that people use. There's lots of triage tools people use, pre-post surveys, etc. So looking at that at a cohort level would enable you to prove that outcome. Employment outcomes after participating in your workshops, newcomers that report a local support network a stronger support network. So again, these are things that are measurable. These are things that you can attribute to your activities, right? So you can create the dots. You don't have to you don't have to make the claim that you're the only thing that's connecting your activities to this client's outcome, but you should have a line of sight between the left output and the right outcome, the right and the left hand side of the screen. And then again, just a note too that why this is so dominant in our reporting is, and why people tend to go towards outputs is primarily because they're just easier to count. So a shelter bed is a shelter bed is a shelter bed. It's hard to argue. A workshop attendee is a workshop attendee, and anybody can verify that number. So it's just the heads and beds concept is much easier to wrap our heads around. Funders still ask for this stuff, so I don't want to make it seem like, funders are moving to outcomes and that's all they care about. It's not true. They still want to see that output data, and they absolutely make a point about tracking it. And that's because this output data is also really important for trend analysis, so you can see demand trends, reach trends, etc. Right? So it's not to take away; it's actually to just amplify that with outcomes questions as well. So that is, the one and two. Three, legacy systems. So lots of the case management systems out there only are able to conceptualize in their data models these outputs. So really tough to collect outcomes if your data system's not really built for it. And so people kind of get stuck in the same rut because they have these old school systems. And then lastly, we just necessarily haven't been asking these questions, right? And they haven't been challenging ourselves to do this because heck, we're busy already with the day-to-day work, so it can't be so much more work. So why do we care? What's the cost of the status quo and what it's costing you right now? The longer this gap is going to drag on between collecting outputs and outcomes, and between how the work happens and how it gets reported, the more it shows up in key places. So the first is frontline staff, where they end up doing the work twice. And these are things that we've been observing. They end up logging the information into case management system and then again into reporting templates for their funders. Every time we do an implementation and we say, can you send us how you're collecting data? We get folders upon folders of templates from every funder has their own template, or funders thinking, I'm going to actually like modernize this and I'm going to make a funding case management system. Well, what happens is the funded organization now enters the data in that guy's case management system and that funder's reporting system and that funder report. And now they've got three forms they have to fill out, and then none of that collects locally into what they need to know as an organization. So then they make their own. And then of course that system's too old. So then they create an Excel sheet to sit beside it because that's really like where they have to work. So that is the reality. It's so sad. It's so sad because people are wasting so much valuable time that could be spent with clients on that mess. So I would say doing the work twice is an understatement of how crappy it is. Very, very, very frustrating. And it's people's entire job just to deal with the mess. So again, the other place that this shows up is in your data and the report nobody really trusts, because when you say, okay, well, can I see that outcomes report or a funding report? Like, man, this is kind of generally what we did last year. So the numbers get cleaned, right? Because you got to take all that mess and you got to make sense of it. And you're like, was that the same client? I don't really know because I can't really trace that client through that system. Am I double counting the clients? Yeah, probably I am. Yeah, probably. Am I reporting the same client to different funders a bunch of times? I don't know. Probably. I'm doing my best, but this is it. So so it creates this sense like that you're not quite standing on the right footing all the time. So you're constantly sitting on this anxiety as a nonprofit, and then vice versa. I mean, funders we talk to are like, well, I don't really trust the data that comes in, right? Because there's no way, we're serving more than the population of our city. Right? That doesn't make sense, right? So they're adding up all these numbers and they're like, this doesn't make sense. So they're not trusting the data either. So there's this kind of mutual unease between both sides. So again, why this matters for decision making, by the time the data gets reconciled, funder-driven, reporting-driven reconciliation of that data, mind you, the funding cycle is half over, the program's already drifted, and the decisions end up being shaped by what's reportable, not by what it's true. So you don't have that data on the fly to make decisions to say, hey, we're actually lagging right now, or did you see our case management flows are slowing down, or did you see we have a demographic spike in here, what's going on? And so you're not able to make those operational decisions on the fly, and you're not able to adjust, like, hey, our outcomes are actually slipping this quarter. What's happening? Oh, we have more complex clients. Okay. Okay, what are we going to do about that? So you're not able to adjust, and guess who suffers in the end? The whole chain, right? The whole outcomes chain suffers. And most importantly, the clients, the communities, and your network of relationships and the sustainability of the sector bigger system wise. So what does it look like when it's in practice? So again, a framework, and I'm going to take you through one sample of a framework out there to think through it. This is a newer one that's really gaining traction. I really like it, but I work with all frameworks because every customer that ends up coming on our system has their own approach. But this is one approach to kind of help you think about it, and it's one that's getting more traction. So I'll use this one as an example, and just to educate some of you that haven't been familiar with it, because it's a federally endorsed common impact data standard that I'm going to be talking about. So a framework that's going to help you move from thinking fallout of the work that staff are already doing at intake and case notes and during program review will be the focus. So this is a short orientation. I encourage you to get more educated. They have their own website. I'm not them. This is just how we use it, because we're a software vendor that has been validated to be a common approach validated software. So this is something that's built into our system and how we think about impact and data collection. So it's a independent Canadian nonprofit, and they were started by Carleton University, became their own nonprofit in 2021, and it's specifically built for social purpose organizations, funders, academics, not imposed by a funder. There are a set of voluntary standards, so it creates a baseline that we can use so that we can share impact data, outcomes data across an entire social sector. So that's why I really like it, because it gives us a kind of a starting point for common measurement as well. And it's becoming where funders are going in terms of a converging standard. So it was selected by the Social Finance Fund. Yes, it was under the Liberal government preceding Carney, but it's still in place. And it's becoming more and more the funder reporting template, if you will, and the most widely recognized Canadian framework for outcomes right now. So, which is why I wanted to just spend a couple minutes on how this works. If you don't have a outcomes framework, this is a really, really good one. And the cool part is it's a way to talk again across your funders, not just one funder, if your data collection system adheres to it, which ours does, but you should be asking your data collection system vendors if theirs does too. So 5 practices for outcomes work that the Common Foundation spell out of what good outcome practice looks like. And this is a really nice checklist for you if you don't have it. Like I said, if you're looking for resources, we can point you in the right direction. So first is describing your intended change. The second is using indicators, obviously, and collecting that useful information through your entire workflow, gauging that performance and impact, and then communicating the use and results. So I'll show you what this looks like in the real world, because it's I'm not saying this is all easy to envision in your head, but I'll show you what these practices look like in a structured way. And so the big core principle of this framework is that reporting should be a byproduct of practice, not a bolt-on, right? So it's not something you do after you collect all your data and then you have to like mash it together and make sense of it. No. that should be just part of data collection. That feedback loop should happen right away. Information collection should be useful, not burdensome. And so that means outcomes data should fall out of what work staff is already doing, not a separate reporting workflow. If a frontline worker has to type the same thing in two systems, that second system's wrong. They fail, right? The funder report should be a query, not a quarterly project, right? So it should be something that just happens as you go. Okay, so where outcome data should get captured, okay, and where it actually gets captured if you have your system set up properly. Should it happen at intake, right? So you should be capturing that baseline. What is the starting point? What do they want to change, right? So at that client intake, you're creating the baseline. It should be happening through case notes or case entries, right? You're doing your check-ins, your follow-ups, you're doing your work, your sessions. So each interaction, what changed since the last contact? And tag that stuff to indicators so you can get that quantitative wealth of data collected as you go. At program review, so in that every cycle, I don't know if you have a monthly cycle, a quarterly cycle, annual cycle, or ideally you should be doing things at all those cycles as well so that you can see what's progressing and what's changing. And then of course the reporting should just be like a no-brainer, right? Because you're already doing this stuff as you go. So it's not a fifth step. It's the same data, just organized differently for a different audience. It's exactly the same data, right? You're just pushing a different artifact out of it. Okay. So what this changes for the people that are doing the work, obviously all those pain points we talked about, less duplication because the outcomes data is in the same place as your case notes, as your attendance notes, if you're managing, or as your pickup, if you're running a food bank or a clothing depot, etc. Obviously, you're going to have more meaning. So frontline workers see their own observations roll up in program level patterns. So the staff, they know what their impact is as well. There isn't this big, rift between what you're making if you happen to be the CEO trying to sell the staff on doing their outcomes, right? It's really about getting the feedback loop to the client and to the staff as you go, right? So that's another major consideration as well. The cleaner audit trail as well. So every claim about impact is traceable, right? So it's not something that that is happening that you have to then question whether it's correct or not. It's absolutely happening as you go. So that is one piece. The other concept I wanted to really get across is this concept of indicators and harvesting outcomes as you go. So indicators are, again, I mean, I'm sure folks are aware of indicators, but it's essentially these data points that you can actually roll up into measures, into quantitative measures, but they're usually preset, planned, and comparable. So this indicator strength are usually numeric. So it's the baseline and the follow-up and the 3, 6, 9, 12 post follow-up assessments of the client based on whatever focus you might have. 10:30, that tells me I should be wrapping up and getting into my demo, but yeah, I'm almost there. So the strength is that tells you that the changes you predicted at the outset are actually happening. The limit to these quantitative indicators and measures is that you are deciding on these things ahead of time. So you still got to think about, how am I going to collect some of this incidental organic stuff as well? So there's a pro and a limitation to these quantitative measures. But for structured outcomes, so things like housing stability, food security, etc., really, really useful. But then again, having the ability to harvest open observed narrative. So changes that you didn't predict, so unintended consequences or unintended effects, so that again, you're able to aggregate those as well, without needing to, to be limited to only the things you can just count as outcomes. So best of that relational or agency work, and again, resisting just looking at numbers by themselves. So outcome harvesting in both ways, the qualitative and quantitative, begins with that question of what actually changed and did we hit our predicted indicators. Indicators will give you those nice charts, and the harvesting will also give you the story behind some of those charts as well. It might actually tell you where else you might need to add collection so that, yeah, so that you can take it to the next level. So translating this to funder language from case note observation to funder narrative, this is the question that we asked you at the registration. How do we talk to funders about a harvested observation? And this would be the structural answer. So an example here is an observation, and we're just going to take it to that evidence-based answer just to give you some step-by-step. So let's say Sarah is booking her own appointments without prompting, first time since intake. The tagged indicator would be her self-managed capacity, which is a qualitative observation, but a weekly frequency. The precondition would be that independent functioning. So the precondition in the program theory of change that we would map out at the beginning of this process. And then the funder question might be, are participants developing self-management? And the answer would be yes. And here's the pattern, right? So you're able to show from observing something, you're tagging that indicators, right? So the staff see something, they ping it in the data system, and then that is connected to a precondition. And then of course that becomes that evidence-based back to answer, but it's also baked in to your data collection because you can see that pattern across your data. And so you're not arguing with the funder. You can literally pull out, again, you're probably not showing Sarah's name in the process, but you're able to actually zoom in to each client to show that, here's how many times they exhibited these behaviors, that we observed this behavior. And then we know that in our theory of change, independent functioning is a precondition, and participants developing self-management is being the funder question. We can show them that this is in fact happening and how many times it's happening across a cohort. So we'll get into how this stuff is real, and I'm going to take you through a use case, and I'll have to switch my screen now because I have to switch gears to my data system. I'll give you some context as well about this organization, and I wanted to pick something super, can you guys see this? Yeah, okay, great. Yeah, so Snowsuit Fund, what this organization does, and this is a brand new implementation, they're still testing it out, but I thought it was, I don't know, it was in my head, so I said let's do it. And there's no more snow in Calgary, so I'm happy not to think about snowsuits for my own family for a bit. But they exist to provide folks that have income challenges, settlement challenges in Ottawa with winter gear. So seems really outputty is why I picked them. I was like, they literally give out snowsuits, but is that where they should stop when it comes to outcomes? And I would argue that no, that shouldn't be the case, right? So as you can see here in their or kind of opening up this data collection system, they've got families registered, they've got kids that are connected to in those families. They got snowsuits. They've got 8 distributions completed so far today. They've got nothing to review. They've got nothing that has to go to distribution, but they've got 14 applications, and they had 14 application events. So again, this isn't to show you guys how to record all the numbers in here, but what I wanted to show you is that oftentimes our data systems kind of stop here. So at the end of the reporting period, we might really just stop there. But if you actually think about this stuff in from a monthly perspective, and you're looking by the way, at fake data, it's just their demo data. In May, this is some of their fake data. They had 8 families served, 13 kids connected with gear and school routine, and 16 30-day outcome measurements completed. So, we'll walk back on how this occurs, but essentially at the beginning of their user journey, when a family comes in, and this is just online for them, they receive a request, and kind of let's do it. I don't know if we want to do it. Actually, let's not do it in French. We'll stay to English. But the family fills in this request for help, right? And they select, their basic things. So here we're naturally selecting their information. We're selecting demographic information here as well that we need to have, not over collecting, because all they want to know are these guys eligible or not. So here's some more demographic information because again, we need to show that they meet Ontario Works, etc. needs. But this is how you start embedding the data collection around outcomes in even before you meet the family, right? So how ready is your kid for winter travel this week? Not ready from 0 to 10. How confident are you that your child will be able to maintain their school or day routine this winter, right? Let's say 1, right? 1, not ready yet at all. And what's the obstacle? Winter boots, snow pants. So you can see already, this is not about snowsuits, right? This is about the ability for the kid to get to school safely. So you just created that baseline before the family even shows up. And so now you've got that baseline recorded. They're scheduling the appointment and then they're ready to go. So that's exactly what happens in here. So the family is now, right? This is again fake situations, but the family books an appointment, the family attends, and then you're able to also collect that school routine stability over time as well. So now you've got a way to track the change and track that change at a monthly, right? So all you're actually doing is every time you see that family, you're checking in with them, the same questions, and you're creating that paper trail to your monthly report and now your quarterly report. Your quarterly report is now actually a little bit more interesting, right? Because you can see the story. You've got 1,400 visits. 88% of those visits had a slot utilization. People show up when they book. And then your operational metrics are document turnaround time. How quickly did you, when the paperwork came in, how quickly did you turn that around? That's important for your ability to show funders that you're efficient. And this is your board of directors, your CEO cares about that too. And then what's that seasonal order of value represented? How much money's worth of merchandise did you put out into the community? This is the kind of market value of those donated goods. How are we looking in terms of seasonal pacing, right? And our annual targets. So this is just a little kind of quality signal as well. So this again just gives you that monthly overview. Now you didn't do anything differently. You're just recording when people come in, right? You're just doing your pickup. You're doing your status. You're doing your regular work in this application and depot visit, right? So what kind of who's attending, who's coming in, right? What season, what kind of fees, what status history. You're not doing anything special. It's just the way that you're collecting this stuff. So I'll show you then the annual roll up. So same data, and yes, it's just auto-populating as we make changes in here. How does this look year over year? How does this look over time, right? So now we're looking at the turnaround, the quality signals, and the outcome story, right? So the current season has been our strongest reach, has the cleanest evidence trail, and that fastest readiness turnaround. So we're able to make that outcomes chain. The family asks for help. We collect that contact detail, the location, the eligibility document, the preferred pickup date and consent. The staff prepare for the visit, and the family stays connected to the staff to coordinate before the depot visit. Applications reviewed. The baby depot. Sorry, we have another implementation for baby gear. depot. The depot visit is completed. We've got the sizes, the fees, the visit status, and then the winter readiness is checked. So now the follow-up measure after that happens is measured to see if the caregivers feel more prepared and kids can maintain that school routine through the winter. And again, that happens on just the regular day-to-day work. This isn't anything new. This is just the same data presented monthly with a more operational focus, presented quarterly for that more kind of board level, and then annually around that impact. And again, we can do really fun things like SROI calculations now. We can do a lot more around the snowsuit inventory as well. We can do a lot more around our intakes if we wanted to create more demographic information that we want to check. But it just gives you I think a really simple way to say it's not just about snowsuits, right? We're not just handing out snowsuits here. We're making sure it gets kids settled in Canada, folks, refugees that come to Ottawa that have never experienced winter before. We're bringing them into an environment that's safe. We're connecting them to resources. We're able to make sure that those kids get to school in a safe way. And that's all in a very simple workflow as well. So that's the kind of little example I wanted to show you. And then I'll go back to the deck instead because we're
Alina, I
just
got a couple
oh
questions.
yeah, absolutely. Let's pause there because I think actually we are in the Q&A. Actually, yeah, we are in the Q&A, so I don't need to share anything right now.
If
Um,
part of the measurement is the family or participant is achieving their goals, is there a way to
hmm.
set this up to be tracked?
100%. Yeah, so you can, I mean, depends what where you want the outcome to link to. We can we can do the linking to the kids. We can do the linking to the household if you have more than one family living together. For instance, we have that. We can do the outcome to the case. We can we can also do the outcome to individuals within a family or the family as a whole. So the family reports, right? So then and then your survey would be well, whatever made sense, right? The head of the family, the representative of the family, or we could do a questionnaires for each member of the family, and then you do a kind of a composite score. So it
Okay.
depends. Yeah, yeah, it depends how what makes sense. So in implementation, if your software provider knows what they're doing, they should be working through this stuff with you so that you're collecting the proper data to make sure your funders are happy and your staff are happy and your clients are happy because that's the other I didn't show it, but satisfaction, right? So the client satisfaction with the service. So that's a bit of a different. We actually have a blog on that, and I think Taj, we should send that out. But what's the difference between the perception of quality of service or perception of your of client opinion on the experience? Sometimes clients like they're like, they'll tell you good and bad, and that's really, really valuable too. But that's different than what we just went through. That's an added element and another angle to it. And you should be collecting satisfaction scores as well. We definitely do. That's a different dimension to this whole thing, and you should be reporting on that too. Again, I didn't show it because we don't have so much time, but that's another way that you should be considering it as well. If that matters, right? And I'm telling you, we've gotten so much trouble in some of our earlier iterations of help seeker products where we would always put client satisfaction out and our nonprofit partners are like, no, no, that's no.
Okay.
This
Next
is not what we
question.
do it. Okay, next one. Okay.
It looks like that. So this is related to Redo. It looks like the outcomes are created by program. Do you have the capacity to set overarching outcomes by client? For example, tracking their journey towards stability and wellness overall.
Yeah, absolutely. So that would be the individual view. So instead of rolling up by program, you just roll up by cases or caseload. So you can look at the portfolio of a case manager, let's say, like you want to see how all their clients are working. and then you just want to see the family journey. Yeah, you just, I mean, I sh I don't know if I have it. I probably okay. You know what? I don't have time to like click through it and show you, but if you're interested, we can show you some examples of that because essentially it's just this the pretty report for the client so that the client can see their journey and their connections and things like that, or their family networks growing. We have a really cool visual in one of our Indigenous organization implementation around child welfare, where the First Nation child welfare entity wanted to show the kind of the family network map and all the connections, all the relationships as well, and then the how that entire network moves through outcomes as well. So
Okay.
yeah, whatever your flavor is, yeah.
It- Next question. This looks great for programs that have some sort of intake/application process. Has it been used for programs that are drop-in or maybe open programs that don't have formal intake processes or application processes?
Yeah. Yeah, it's funny. I picked this snowsuit fund because I thought it was somewhere in the middle of the kind of the drop-in center versus the really intensive case management housing first programs that have really intensive touch point at a clinical level. Because I thought it was a good middle ground. But yeah, we have some programs like the um, homelessness outreach in Kelowna is actually a really good example of that, where they don't even know the names of the folks they're interacting with. I mean, they might, but they shouldn't collect it, right? So they have a way of um, tracking the outputs. Now, interestingly, a lot tougher to attribute outcomes there. Their funders are looking for outcomes like uh, the return on investment of harm reduction supplies, for instance, that are distributed. So you have to kind of almost do an inference and an SROI calculator to kind of to show that value proposition because you don't know the names there. The other way is also though to look at kind of, are there less people that are kind of showing up with the same problem. So you can track at the cohort level in an anonymous fashion, or you can versus individual level. So that's kind of one way of mitigating it. And then the other one is you can still ask, hey, did this satisfy your need? Right? Yes. And then you just log anonymous things. Events are really good. Big cultural events, you can still collect data for that too, outcomes data. It's
Okay.
just looks a little bit different. Yeah.
Do you have issues with getting surveys completed, or is completion tied to ongoing service?
So that's an operational question for not for us as the vendor of software, but it's more for the organizations that's providing the service. So off what we see, um, is that they tend to do a kind of a voluntold type of approach, oftentimes where the staff are told by the funder that they have to do it for funding, and then the staff kind of have to sell it to their frontline teams, and the frontline teams kind of mumble and grumble about sometimes, but they get it, and then in terms of the clients, yeah, you can't make people like fill out a survey like that to get service. I get how difficult that might be. So you have to do a nice job, making it super easy and valuable and explain what happens to the information and all those things. But you have to do that anyways for consent. So part of the consent and onboarding of the client into the program should be, here's the kind of how we will work together, and here's why that's important. And people tend to be pretty understanding. And when they're not, you have to make a decision, right, of whether you're still going to provide that service, and even though you're risking your funder non-compliance in some cases. Sometimes you don't have a choice though, right?
Okay. Next question, which is from a bit earlier from your deck. If
Mhm.
historically data has been shaped and cleaned up, how do you move to true data without funders thinking you are now underperforming?
Ooh, that's a gooder. That's a gooder. Yep. Yep. That's a good one. We should talk. Lots of examples of data coming in for migrations into our system. And so they'll get a dump from whatever. I'm not going to name the systems. You know who you are. So they'll be like, "Oh yeah, we have 5,000 clients." And then you get the data and you're like, "Oh God, you don't. They're all like duplicates or like the system like was creating duplicates all over the place or like anyway, there was one instance where like every like family was like triple booked. So it made it look like it was three times, or every program had its own. So yeah, yeah. How do you do that? I mean, I'm not gonna give advice not knowing your context because it really depends on your funder, it depends on your system, and it depends on whatever. All I can tell you is that it happens so much. So I think funders need to, if they really want outcomes and they want good data that they trust, they're going to need to, create the safety for this stuff to happen too and to have real conversations. However, on the other side, you want to get ahead of it because I've also been on other projects with provincial governments, for instance, where we're now being asked to create provincial systems that look at common clients across all the nonprofits. So, like, it's going to happen at one point, at one way or another. So, yeah, you want to get ahead of it. So, you don't want to get caught off guard. So, get the data out of your system, number one, and see what exposure you have. Like, how bad is this? Right? Is it as bad as tenfolding misreporting in your data system? That's a different communication than like 10% is not quite right. So, and if you want to have a convo about it, yeah, I'm happy to share a little bit more in depth if I understand what's going on and you don't need to out yourself in a webinar.
Awesome.
Next question.
That's all the questions.
Oh my gosh. Okay, that's fantastic. Okay, good. I'm glad I got it there. So yeah, if this stuff is of interest and you want to talk more, like I said, we built this thing with all of you. We're social sector people ourselves. We just happen to also be developers of technology. So that's the value add. And that's where we see that we're very, very, very different than anything out there, is that we're not a bolt-on. Outcomes are built in this process. And we help you define your outcomes as part of implementation. We don't just, not to say that we call you out, but we will prod you along too. And sometimes organizations are not quite ready, but part of our monthly touch points are, here's your dashboard, here's your report. This as a CEO, did you know? Or as a program operations manager, did you look at this? Look at your clinical outputs. Maybe it's time to start introducing some outcomes. So we'll prod you along a little bit and we just go at your pace. So it doesn't have to be all or nothing. It's just starting that journey. So that is the big stuff. And if you're looking for something that's Canadian and OCAP aligned, I would definitely say we should be a contender in your process. Not to say United States products are all bad. It's just if you're looking to buy Canadian, we're fully Canadian, and our data and all that is in Canada, and we're a Canadian company. So just to recap, plain terms, outcomes are defined once and at the program level where they belong. The baseline lives in the intake, not in separate evaluation forms. The observed change is captured as part of the ongoing process, and that work that produces these things as organic. So it's not just this thing you do for the funder. It's just as you go about your day, you're harvesting your outcomes. The funder report is a query and auto-populated. As you saw, like it just auto-populates the report, not a quarterly data headache. And the outcomes and indicators and outputs, all that stuff lives together because impact is not just one template. So the same workflow runs, like I said, the child, the family, and the same thing can work at the household level, family level, but it can also work the same way across mental health, justice, settlement sectors, Indigenous wellness, and any other programming typologies. And whether that's at the kind of really long-term engagement with clients over years and years, one-on-one, or whether that's a major awareness event and kind of a one and done intervention. You can still do a lot. Bigger picture, why this matters past your next funder report is when outcome data lives inside the works and it's not bolted on top, we can get reporting that becomes routine. So they stop being this fire drill, like we need our report, we need to get it in. They become just a not even a query, it's just built in, right? It's just there. The org becomes a learning organization, more importantly. So the patterns surface in real time, like I was showing you. You can see what's happening today, what happened this month, or are we on track? Are we behind? What's working, what's not? How do we adjust? Like we're slipping behind our in the snowsuit fund, seeing that you're taking longer or your inventory is running low because you have more demand. You're seeing it on a day-to-day basis. And the frontline staff stay, right? So that reward is right there. It's in the dashboard. They see their impact. They see their return on investment themselves. They can articulate it to each other. They can articulate it to their clients, and the client can also articulate it, especially if you're, as somebody suggested, we should make sure that the client has a copy of their outcomes journey as well. And that kind of concludes it for today. Plug for our next webinar. You're not gonna hear from me. You're gonna hear from Ashley Kinnaird. She's an operations manager from BC, and this is an organization that actually looks at runs a very, very complex programs. It's a First Nations agency, and she's going to share about how they're moving from a real lack of org level insight and how they're actually connecting their case management work, their child family services, but their housing, their HR, their financial operations, like the whole entire thing, and putting data sovereignty and Indigenous sovereignty is held throughout. So obviously a really, really interesting use case. So if you have really complex programs, if you're worried about the Cloud Act, the United States Security Act, if you're running a US system, come see this one. It's really interesting and what she's going to be talking about. And that the real sensitivity level about how do you put data in where you've got your maintenance crew using the same data system as your obviously your child welfare staff, and how do you maintain that integrity and that sensitivity, data sensitivity operationally, yet roll things up at an org level to understand that, hey, if you don't have a maintenance crew going out there, you might not catch some really important things, because lots of good case management happens when your maintenance crew enters the building and sees what's going on there too. So really, really interesting one, May 21st, 10 a.m. And then the week after that, we've got another one I'll talk about. This one is about intake. So just really digging into that intake process and how that can improve your service delivery, reporting, and decision making. So lots of different ways to do intake, the anonymous, the deep triage, the assessment embedded at intake, and then how do you actually link the outcomes and funding reporting and baseline reporting into that. So if you're interested in intake as a concept and you're thinking about redoing your intake process, what kind of questions belong at intake versus follow-ups versus exit, right? This might be a good one for you as well. And that's on June 4th at 10 a.m. Mountain Time as well. So yeah, thanks you guys. Thank you for coming, and I wish you a very awesome rest of your day. Hopefully this was useful. I really enjoyed the refresher myself on outcomes versus outputs.